Mental health care must come to where people live, why England's new community hubs could be a turning point.
For far too many people experiencing mental health difficulties, asking for help can feel like an exhausting journey before they have even reached the first professional. They may spend weeks or months waiting for an appointment. They may not know where to turn when their distress suddenly becomes overwhelming. And for some, the only door that appears to remain open is the accident and emergency department. That is why the government's announcement of plans to establish nearly 200 community mental health centres and dedicated mental health A&Es across England deserves serious attention. The proposal to create 100 new community mental health centres alongside 59 additional mental health emergency departments represents a potentially significant shift in how we think about mental health care. Most importantly, it recognizes something that those working on the front line have understood for years. Mental health support needs to be accessible before someone reaches crisis point, bringing mental health support into the heart of communities. Perhaps one of the most encouraging aspects of these plans is the intention to locate some of the new centers in familiar community settings, including libraries, banks, and other high street locations. This matters. A mental health service does not necessarily need to look like a hospital. For someone experiencing anxiety, depression, emotional distress, or the early stages of a mental health crisis, walking into a traditional clinical environment can itself feel intimidating. A library, community building, or familiar high street location can feel different. It can say, you don't have to be at breaking point before you are allowed to ask for help. That is an important cultural shift. Mental health care should not only be available when someone's circumstances have deteriorated to the point where emergency intervention is required. It should also be visible, approachable, and embedded within everyday community life. Prevention cannot simply be a slogan. The government has described the initiative as part of a wider effort to focus on prevention and earlier intervention. We strongly support that principle. We have seen the importance of creating opportunities for people to access support before their difficulties become more severe. Early intervention can provide someone with the opportunity to understand what they are experiencing, develop coping strategies, strengthen their support networks, and begin addressing difficulties before they escalate. But prevention requires more than